Hi students, today we will discuss about one of the medical condition, asthma. So asthma is a non-communicable chronic lung disease characterized by any obstruction in airway or airway inflammation or airway hyperreactivity to any irritants. So as you know that our respiratory system has the main function is respiration. Respiration means inspiration and expiration. While we are inspiration, it is we have inhaled the oxygen and where in its expiration we are exhale the carbon dioxide. While we are inhale the oxygen, the air become moist and warm. That is no evidence of the allergens or irritants. That time our bronchioles become expand and allow the air easily. That means easy to exchange the oxygen and the carbon dioxide. If any evidence of the irritants, any allergies, when the air become dry and cold. So that time our bronchioles become contract and it will leads to the problem of the exchange of oxygen and carbon dioxide. So here we can discuss about the what are the main etiology of the asthma. First one is the environmental factor. Under the environmental factor we can see air pollution and allergens. The air pollution such as particularly environmental tobacco smoke, mosquito coil smoke, dust, spray and perfume and all. So allergens such as indoor and outdoors. Indoor we can see the pet animals, example dogs and cats. And allergens, so in outdoor we can see any pollens, fungi, molds or yeast. So next one is the viral infection, another etiology or cause of the viral infection. So viral infection, I can give you one of the best example. Now we are facing that COVID-19. That is the one of the viral infection when it will be enter in our respiratory tract that will leads to the respiratory distress. That is very difficulty to exchange oxygen and carbon dioxide. So next we can see the any seasonal variation. Any other cause. Seasonal variation means sudden changes of the climate that will affect our respiratory function. Next cause is the diet. Certain foods like that peanuts, eggs, wheats that will be trigger the respiration. Or next is the drugs. Drugs such as aspirin and beta blockers. These both drugs will depress the respiration and chances to contract the bronchioles. And last one is the genetic factors. In genetic factors, we can see any family history on certain genes. So these are the main etiology or causes of the asthma. So next we can discuss what are the pathophysiology of this asthma condition. So already we have discussed the etiological factor. This due to this etiological factor, it will leads to swelling of the membrane that the line of the airway. That means edema of the mucosal line. So that will leads to the narrowing of airway and increased mucus production. When there is increased mucus production, that will leads to the accumulation of mucus inside the bronchus. When the accumulation increasing, so that will leads to the difficulty to pass the air. That means spasm it will be occurring in the bronchus or bronchioles. So finally we can see that when the spasm occurring in the bronchioles, it is there is a narrowing or obstruction completely block the airway. So finally we can see the decreased the function of the bronchioles. Okay, next we can discuss the what are the clinical manifestation of the asthma. We can see that there is a recurrent cough and wheezing, dyspnea, chest pain, abdominal pain, cyanosis of the nail buds and dark red color in the lips because we know that there is a decreased oxygen in our body. So it will leads to the cyanosis of nail bud and also there is a dark red color in our lips. And diaphoresis, increased sweating will be occur and tachycardia and light headache and lethargy. Feel very tiredness. So after this clinical manifestation or signs and symptoms, we can see the diagnostic evaluation. As you know, before we are whatever disease condition going to evaluate the patient, firstly we have to do the history collection and the physical examination. So under the history collection, a complete family history we have to collect. and also environmental and occupational history is very essential. And physical examination, we see all over the lungs, cyanosis and breathlessness and cough. Include the head to foot examination. We should analyze these all the symptoms also. And chest X-ray, we know that chest X-ray will not leads to the diagnosis of the asthma, but even though it will helpful the excluding a pneumothorax, which can occur as a complication of asthma. And lung function test or pulmonary function test show variable airflow limitations we can identify through this lung function test, and blood test and also sputum test. So after the diagnostic evaluation, we can go for the management. Here we can see the main goal of the management. It is achieve and maintain control of symptoms and prevent development of irreversible airflow limitations and maintain pulmonary function as close to normal possible and prevent asthma mortality. So these are the main goal of asthma. So next we can see oxygen therapy. The first medical management is oxygen therapy. And before we are giving the administration of oxygen, we have to keep the patient in upright position and start the oxygen 50 to 60% initially and continue till the patient is better and not dyspnea. Already we know the person has already breathing problems. While we are administering the oxygen, the person will be recover from this breathing problem. Up to that we have to administer the oxygen. Second one is the nebulized with the salbutamol or terbutaline for the immediate relief. Salbutamol 5 mg, that means 1 ml with 1 ml saline. We have to repeat the dose at 50 minutes if required during the first hour. And hourly for the next few hours till bronchospasm is controlled. Up to the bronchospasm is controlled, we have to provide the nebulization. As you know that salbutamol or terbutaline is the medication will help to the where there is accumulation of the sputum or we know that in pathophysiology we have studied in the bronchus and bronchioles, it will the secretion will be increased accumulation. So it will help to remove that all the accumulation where the bronchus or bronchioles, and it is relieve the bronchospasm also. That will allow to the easy breathe. And next we can see the antibiotics. These antibiotics we can provide if the patient is had any kind of infection, we can provide the antibiotics. And next medication is the corticosteroid. The corticosteroid is the anti-inflammatory medication. They are broadly effective in allowing the symptoms and improving airway of the function and decrease the P flow of variable. And initially we can provide the corticosteroid as a inhaled form of used. Okay, so these are the main medication we can provide the asthma patient: oxygen therapy and nebulization, antibiotics and corticosteroids. Next is the main role, that is the nursing management. Under the nursing management, we should evaluate the respiratory status and patient general condition. Okay, so next provide comfortable position. Even though patient is feeling difficulty to breathe, we should give the upright position or sitting position. It is easy to breathe. Next is the providing emotional support to the patient and to give health education about disease condition. And we have to administer the medication as per the physician order. Maintain adequate dietary intake and also administer fluid if the patient is in dehydrate. So hope you all understand the asthma. Asthma is the chronic lung disease and it is mostly, it will result we can see the breathing difficulty, and by the help of medication, oxygen supply, nebulization and corticosteroid, with the help of these drugs, we can recover the patient from the asthma, and also we can give the comfortable nursing management to the patient. Thank you.